Good afternoon, everybody. It's Dr. Bertolino from Smooth Solutions Medical Aesthetics, the head doc. Another reel we're doing today on frequently asked questions on most of our services. A big one I think most people want to know about is hormone replacement therapy. So we get questions sent to us by email. We get questions from phone calls. We get questions from people who come here for other services. And one of the services that we've done the longest here has been bioidentical, which is natural hormone replacement therapy. So some of the questions that we get are, the first one, which is obvious, are hormones safe? Are sex hormones safe? And what are the sex hormones? So, number one, yes, they are safe. Yes, the FDA finally admitted that the studies that were done in the 1980s, the Women's Health Initiative study, was flawed, totally flawed and wrong. That was the study that set the fire that burned down all the women because nobody wanted to do hormones because they were afraid of cancer. The FDA commissioner has recently been on television within the last month saying that estrogen does not cause breast cancer. So it is a safe modality, and you'll see more and more of it out there in the public because now people are getting used to it. The other question is, well, what are the hormones? Well, you have to remember that women have three estrogens: estrone, estradiol, and estriol. Three vital estrogens that they will lose as they go through perimenopause, into menopause. The main one of the three estrogens that is what you have to know about is estradiol. A man has estradiol, but we don't lose it. The women lose it, and therefore they suffer with certain symptoms. So estradiol, the first and basically the strongest and best estrogen of the bunch. The second hormone is progesterone. Progesterone is a vital hormone. It is not only there to protect your uterus. Lots of women lose their uterus after having a hysterectomy. They should not be denied progesterone. Progesterone works in protecting the uterus, and it also works in the brain. It forms a hormone called GABA, which actually helps a woman calm and sleep. Insomnia of menopause is waking up and can't go back to sleep. And this is a safe, non-addictive way to do it. And progesterone also, with estradiol, helps your bones. The third hormone, of course, is testosterone. When I went to medical school, testosterone was not a part of my learning. We didn't talk about it in men. We didn't talk about it at all in women, but it is a vital thing. Remember, hormone replacement is a three-legged bar stool. If you cut any one of the legs off, ladies, the stool doesn't stand up. Estradiol, progesterone, testosterone. Where do these hormones come from? Well, for the longest time, they have been made synthetically, and they still are, through pharmaceutical houses. But with the new push into integrative medicine and functional medicine, we like to blend the traditional medicines, which are pharmaceutical, with the more holistic treatments that are out there that doctors for the longest time didn't want to talk about. So these hormones are plant-based. And then the big question after that is, what is the big difference between having a synthetic hormone versus a plant-based hormone? Well, it's very simple. synthetic hormones, birth control pills after a certain age, injectable testosterone in a man after a certain age, can predispose you to pulmonary embolism. Doesn't mean everybody gets that, but it's something we have to be cognizant of. Not with the plant-based stuff. We have never had a problem in almost 21 years of doing this particular treatment. They call and they always want to ask, what are these pellets and how are they administered? Well, we like to do pellet therapy. And this box is a box of male 200 milligram pellets. This is a box of 25 milligram testosterone pellets for women. And this box is a box of estradiol 10 milligram pellets. We like to place the pellets in subcutaneous fat. So the next question is, what's subcutaneous fat? Well, if we look up on this chart over here, and this is my lipo chart, we like to talk about visceral fat, which is part of your GLP-1s to lose weight. And then, of course, we have subcutaneous fat. Why do we stick the pellets in there? Pellets have the ability to degrade slowly, like a time-released agent, into the fat. And what does the fat have that helps them? Blood flow. That's why we can transfer fat and use it cosmetically. So you have to know that this is a very novel way to get about a 3 to 4 month coverage of the benefits of the hormones. You will see a decline after that, and of course, then that's the point that you want to maintain. What is the downside to doing this is another question. Well, it is a small procedure. I suppose you could get an infection. Try to do it very clean. How do we monitor the hormones? If you're doing hormone therapy, you have to monitor the hematocrit in the blood. That's part of the blood count. Even though we have never seen a clot with a bioidentical hormone, it doesn't mean that you should not monitor for that. So especially in men, when I see the hematocrit rise to a certain level, those guys, including me, have to go for bloodletting. What does that mean? Go to the Red Cross, donate blood. Remember, blood donation in general is a very healthy thing for the body. It is an oil change for the arteries. So giving blood, no matter what you do, is great, but if your crit is too high, we recommend that all our patients go and donate some blood before the next round of hormones. How long do I have to be on these hormones? That's your decision. That's your decision based on your age and your physical health. It is not for me to tell you should continue these until you're 95. My 95-year-old mother is not on these hormones. But as a woman, especially ages and is becoming a setup for osteoporosis and fracture, yeah, she should be on them probably starting in perimenopause. And then that question leads to, when do you start hormones? Let's say as a woman, I say you started in perimenopause. Why? Your plane is declining. Why let it crash? If it crashes, your bones crash, your muscle mass crashes, and your brain crashes, your memory. Treat it in perimenopause, and as the plane keeps flying, it will get older, but you will be covered. Remember, andropausal men need testosterone for the same reason. It is not about erections. It is about bone mass, muscle mass, fatigue, attitude, thinking, and some libido thrown in for both sexes. What's wrong with that? I mean, we don't get too many things free in life. So hormone replacement, like we tell all our people, is a health benefit, and you guys have to remember that. If you have questions on hormone replacement therapy, or your friends do, please have them call us, and we will make them understand that this is probably the right way to go. Our telephone number is 716-633-6100. You can read about it extensively on my website at smoothsolutionsmed.com. And I thank you for listening. Please follow us for the rest of our frequently answerable questions so that you can learn about what we do here at Smooth Solutions. Thank you very much and have a wonderful week.